Hello, welcome everyone. Today we will be discussing a very important topic on a disease that causes millions of deaths worldwide. We will be discussing viral hepatitis. I'm your host, Diego, and let's get started. Now, let's start with the basics. A definition. What is viral hepatitis? Viral hepatitis is an infection that causes inflammation and damage to the liver. The term comes from ancient Greek, where hepar means liver, and the suffix itis indicates inflammation. Now, let's look at some characteristics of the liver. We understand that it has a conical shape. It weighs around 1.4 to 1.8 kilograms, which can vary depending on the gender. For example, in men, it can weigh 1.8 kilograms, and in women, it can weigh 1.4 kilograms. Now, in terms of its division, it is divided into the right lobe, the left lobe, the quadrate lobe, and the caudate lobe. Now, in terms of irrigation, it receives blood from the hepatic portal vein and the hepatic artery. Its width is 26 centimeters, its length is 15 centimeters, and its thickness is 8 centimeters. Now, in terms of anatomical relationships, it is located below the diaphragm and is closely related to the gallbladder, the stomach, the small intestine, the ascending colon, and the right kidney. Now, when the liver is healthy, it is smooth and brown in color. However, when it is diseased, there are changes in this color. It turns a more grayish green, and it appears rough. It may also change in volume depending on the extent of the damage to the liver. Now, let's go on to the functions of the liver. Now, we know the basic functions. It detoxifies you from drugs, alcohol, fatty acids, steroid hormones. It turns ammonia into urea, and it also detoxifies you from environmental toxins and allergens. Now, we know that it produces cholesterol, the precursor to sex hormones, with vitamin D, and it stores micronutrients. A few examples of these are minerals like copper, zinc, magnesium, and iron. And it also stores vitamins like vitamin A, D, E, K, and B12. We also know that in terms of blood sugar balance, it stores glycogen, it produces bile that is needed for digestion, and it also synthesizes proteins. These needed for blood clotting, cholesterol transport, immune function, and it also metabolizes in terms of converting T4 to T3. Now, we also know that it synthesizes coagulation factors like factor 2, 7, 9, and 10, detoxifying blood. Now, there are several types of hepatitis, classified into different types of letters, such as A, B, C, D, and E. Now, due to the different viral causes that provoke it, each one has its different transmission method, severity, and treatment. Let's dive into each and every one of these. Now, first we have hepatitis type A. Its etiology is the hepatitis A virus, HAV, and it is transmitted fecal-orally through contaminated food or contact with another person. It most commonly affects children, adolescents, or young adults with an incubation period of 15 to 50 days. Now, moving on, we have hepatitis type B. Its etiology is the hepatitis B virus, HBV, and it is transmitted through contaminated blood, sharing needles, and can be transmitted from mother to child. It mainly affects adults, but there can also be perinatal transmission. its incubation period is from 45 to 160 days. Moving on, we have hepatitis type C. Its etiology is the hepatitis C virus, HCV. It is transmitted through contact with blood, body fluids, or parenterally. And it mainly affects adults aged 20 to 30 years, with an incubation period of 2 to 12 weeks. Now, moving on to hepatitis type D. Its etiology is the hepatitis D virus, HDV. It requires the presence of hepatitis B for infection to occur, and it is transmitted through body fluids or blood contact, affecting all age groups. It has an incubation period of 2 to 8 weeks. And lastly, we have hepatitis type E. Its etiology is the hepatitis E virus, HEV, and it comes from the Calciviridae family. It is transmitted fecal orally through food or previously infected individuals. It affects all age groups and has an incubation period of 2 to 9 weeks. It can be lethal in pregnant women. Now, let's talk a bit about the risk factors for hepatitis. For example, for hepatitis A, factors such as poor sanitation conditions or travel to endemic areas can cause contagion. Therefore, frequent hand washing, washing fruits and vegetables, and vaccination can prevent this disease. For hepatitis B, unprotected sexual contact, sharing needles, occupational exposure, and childbirth can cause this contagion. So using condoms for safe sex or vaccination can prevent transmission. Now, for hepatitis C, factors such as hemodialysis, unsafe tattoos or piercings, and blood transfusions prior to 1992 can indicate contagion. So, it is good to get tattoos in authorized places, avoid those with used needles, and avoid contact with infected blood. Now, let's see a little bit about pathophysiology. How does it work? The hepatitis virus enters the body and it infects liver cells, known as hepatocytes, and undergoes viral replication. The immune system recognizes the presence of the virus and triggers an inflammatory response to combat the infection. This is known as hepatitis and can lead to liver fibrosis, making it a very dangerous disease. Now, let's move on to incubation phases. There are 4. The initial phase, where there are no symptoms. The acute phase, where symptoms such as jaundice, fatigue, choluria, and general malaise appear. The convalescence phase, where there is persistent fatigue and weight loss, and the chronic phase, where complications such as cirrhosis, cancer, or liver failure can occur. Now, let's talk about diagnostic aids. The most accurate study to determine if hepatitis is present in a blood test is that of a blood test. We need to observe that the total bilirubin is 0.3 to 1.2 milligrams per deciliter, and that there are no alterations in the values of transaminases or alkaline phosphatase. We also need to ensure that the tests for anti-HBC and anti-HBs are negative. Now, let's talk about considerations during consultation. As dentists, we need to take a complete medical history, ensure that all data are accurate to make a good diagnosis, and we need to take infection control precautions to prevent injuries like sticking needles into our hands or anything else related to having instrumental next to our patients. Now, we need to evaluate the patient's liver status in case of complications during the consultation, and we need to communicate with the patient's doctor and avoid unnecessary invasive procedures. It is important to have knowledge of the subject because if we get infected, we may not know what to do, how to treat the patient, or how to prevent the transmission of this disease. Thank you for your attention. This has been all, and together we can make sure that people are aware of this disease. Stay informed, stay healthy, and goodbye.